Hi, my name is Navdeep Kaur.
Shelly,
Pavitterjeet Kaur.
Harpreet Kaur, Amandeep.
Lakdeep Kaur. Today we are going to present the community assessment on the topic of homelessness in Toronto. Firstly, I'm going to give the overview of my topic. Homelessness is a growing issue in Canada. Homelessness describes the situation of an individual, family, or community without stable, safe, permanent, appropriate housing. Approximately 235,000 Canadians are homelessness. Unfortunately, this number has been rising over the years. Toronto holds the most significant number of homelessness people in Canada as comparison to the other provinces. So in this presentation, our group will going to examine the needs of the homelessness and also consult that needs with the stakeholders and the decision maker by with considering the ethics and advocacy of the homelessness people, and also give the priority to the voices of the homelessness people while speaking with the state government officials or the stakeholders, and as well as we also consider the risks of an homelessness people. Next, why we chosen this community? Actually, we choose the community that is the Toronto because Toronto experiencing more than 8,500 people are experiencing houselessness. And the reason for choosing the Toronto is that Toronto has a shortage of affordable housing, and many individuals experiencing homelessness they rely on the temporary shelter, emergency services, or the friend hospitality, and other live rough in the parks and the allies. And also homelessness impact a wide range of the people, since many homelessness people are socially ostracized, stigmatized, or in dangers, which impact on their mental health.
To discuss the types of assessment to be conducted for the homeless people in Toronto. First of all, we will do the need assessment. In need assessment, we're going to follow some steps as follows. Firstly, plan. In plan, we're going to decide the things we already know and we don't know. The things we don't know, on the basis of that, we're going to define our questions we're going to ask the community. So, the question we will ask after asking questions, we're gonna collect the data techniques. In this data collection techniques, we either gonna go with the interviews or the surveys. These are the best effective method to collect the data from the people. After that, analyze and prioritize data. In this, we're gonna evaluate the data we collected from the community, and after that we're gonna prioritize their needs, that what things they need the most. Now, I will discuss the reasons behind doing the assessment. Firstly, for support. If we do the assessment, then we come to know like what are the basic needs of the people suffering homelessness. After that, for evaluation. In evaluation, we prioritize the needs of the patient we assessed in the first tab, and with this prioritization, we can find the solutions. Next is for finding solution. As we all know, if we assess the needs of homeless people, then we can like find the solutions for according to that. Next is for awareness about current issue. As we all know, with the assessment only we can like find out the percentage how many people are suffering homelessness in Toronto, and we can aware the people about this issue so that they can participate voluntarily in this issue and we can address this issue as well.
Hello everyone. Now I'll be explaining the risk factors for homelessness. So the first risk factor is mental health and substance abuse. Health associations report that 1/3 of all homeless people live with mental illness. This is because of the individual's ability to secure employment or housing. The second one is marital breakdown and abusive relationship. Homelessness may be the outcome of efforts of a person to maintain personal safety and escape abuse. The next one is affordability. As the prices of housing are rising, so there are many people who cannot afford the proper housing. The next risk factor is institutionalized care. So people who are leaving the criminal justice system to re-enter society may not be accepted by the society, leading them to be homeless. In addition to this, there are various other risk groups for homelessness. First of them is age. Mostly it is reported that people among 50 to 64 years of age are homeless. Then is the race. The Aboriginal people are reportedly more homeless than the non-Aboriginal ones. Then is the extremely low income of the people, which leads them to be homelessness due to lack of affordability. The fourth risk factor is disruptive events in the youth. There are many people who are reported as with the death of their parents who are living in the foster home and cannot get their own home in the later years of life. The next one is victims of robbery or rape. Such victims are not accepted easily by the society and leads to homelessness. And the last one is prior history of homelessness. That's all with my topic, and the next slides will be discussed by Aman. Thank you.
Discuss about the community strengths. So here are all the community strengths: social, intelligence, kindness, authenticity, humor, and persistence. So in which, like the organization who are providing the strengths to the community, the people who are homeless. So the people who are homeless, they are interact with each other and they know their rights. Socially, they are more aware now, and they are more intelligent than the previous time, and they know that how they can manage their all rules and regulation and the rights of them. So that's why the challenges that are faced by the homeless people. So here are all the challenges like they have limited access to healthcare, they have a limited access to food and all the things because they don't have shelter to live. They will feel trouble in staying safe. Obviously their environment around them are not will be safe because they don't have shelter, they don't have any family, they don't have their privacy and all. So if they feel these kind of things, they will become stressed, and just because of the unemployment they feel poverty, and the poverty, just because of the poverty, the mortality rate will be increased. And if they have the excess limit of the healthcare, their disabilities they will face, and their living condition will be really unhygienic. So these all become these challenges experienced by the homelessness. Next we will discuss about the organizations. Next, the organization which handles homelessness people. So here are the some organizations: Canadian Housing Renewable Association, Center for Equality Rights in Accommodation, Center of Toronto Housing Homeless Sports, Fred Victor Center, Habitat and Humanity Toronto, Houselink Community Homes, Home First Society, and Raising the Roof. These are all which handle the homeless people in the Toronto, and they help the homeless people to have shelter and have food and all the services. Now we will discuss about the service.
Hi, my name is Harpreet Kaur and I'm going to present these slides. So these slides, as we all know, that states the stakeholders. So there are different stakeholders in Canada. The first one is youth-specific services that collaborate with food banks and other community centers. They act as a crucial part, and then they help to provide the unsheltered count the shelter. And the second one is youth outreach workers. So they are helping in locating recognized places or hotspot where adolescents can reside. So the third one is youth drop-in centers. So youth drop-in centers, many youth don't want to get engaged with the organization, so these youth drop-in centers may help them. Neighborhood police departments can actively act as a department which helps to find the proper place for the homeless, and then also act in the event of emergency. And the last one is the local school and the boards and communities that closely work together to help the homeless people and also educate the school employees to participate in the youth count. So this slide I'm going to present the gatekeeper. So gatekeeping is a practice of a local government that either rejecting a homeless applicant's application or failing to properly list the information that necessary to evaluate the applicant's eligibilities. So this situation arises in three different scenarios. The first one is when there is a overload frontline local government employees. The second one is shortage of suitable housing, and the third one is high expense of obtain emergency housing. So despite of these excuses, a local authority offer for its errors, this strategy is prohibited and can only be challenged in court. The High Court is the only place where a judicial review may be used as a last option. So in the next slide, the approach. So in this slide, I'm going to discuss the approach that we used. So we used the cross-sectional analysis. In this analysis, we used two different types of studies. The first one is ethnographic research, and the second one is comparative study. So in the ethnographic research, we used to closely watch the homeless people, and we decided that what we intend to study. On the other side, in the comparative study, uh, com- we used to compare the general population with the homeless population to get a whole idea, and so that we can make a proper analysis. Thank you.
Hi, this is Lakdeep Kaur. I'm going to present about the strengths and limitations of community process in the first is the involvement of stakeholders. It is a community assessment involves a range of stakeholders, government officials and services, and it ensures assessment is comprehensive and account multiple perspectives. In the next is a data driven, in which it's a kind of assessment process. It identifies the extent of homelessness in Toronto, including demographic information and patterns of service utilization. This data can be used to develop evidence-based solution to address the problem. In the collaborative approach, the community assessment process is a kind of a collaborative process in which it helps to ensure the resulting strategies for addressing homelessness are inclusive and reflects the needs and perspective of the entire community. In the limited next is the limitations and the limited scope is only a snapshot extent of homelessness in the Toronto at a particular point in time. In the data quality issues, it is a complete or inaccurate, particularly difficult to survey or provide false information. In the resource limitations, it is a kind of may limit the scope and depth of assessment, as well as the ability to develop and implement effective solution. This is advocacy and ethical considerations for community assessment, in which it is essential to involve people experience homelessness in the community assessment, because it helps to engaging the people experience homelessness can help to ensure that their voices experience are heard and that assessment accurately reflects their needs. In the respecting privacy and confidentiality, it's important to respect their wishes and protect their personal information. This may involve using anonymous surveys, other methods to collect data, and ensuring data is stored securely. In the avoiding stigmatization, community assessment about the homelessness should be conducted in a way that avoids stigmatizations. It can be done by using respectable language avoiding stereotypes or assumptions about the causes of homelessness. In the advocating for changes, community assessment about the homelessness can help to identify areas where support is needed. It is important to use assessment findings to advocate for the systematic change and not address the root cause of the homelessness and support people experiencing homelessness. In the ensuring accessible to people experiencing homelessness, like different methods of data collection such as surveys, interviews, physical and accessibles. Here are some references from where we took our content. Thank you.